Drugs. No, not just those drugs. When most people hear drugs, they only think of overdose, or the ingestion or application of a quantity of drug greater than recommended, causing the drug to overwhelm the body, which can lead to extreme nausea, bradycardia or decreased heart rate, unconsciousness, oh no, and of course, death. Crisis, ongoing and excessive use of psychoactive drugs, such as alcohol or opioids. Addiction, or the reliance or feeling of necessity for certain substances like alcohol or pain medicine. Some other examples being NSAIDs like ibuprofen or acetaminophen, which is otherwise known as Tylenol. And again, opioids. Lastly, the term drug is commonly associated with getting high, tripping, or feelings of euphoria. These are all examples of real drug impacts experienced by a vast number of individuals in our world. However, the term drug will be used throughout this video in reference to its wider definition. According to the National Cancer Institute, a drug is any substance other than food that is used to prevent, diagnose, treat, or relieve symptoms of a disease or abnormal condition. Drugs, medications, prescriptions, medicine, antibiotics, supplements, cures. All of these terms reference one central ideology: treatment in the form of pills. Pills on the shelves in all of your favorite grocery stores. Herbal remedies your mom told you to take when you had a cold. Supplements down that one weird aisle in the health food store. Medications given in a hospital. Vitamins claiming to boost anything from your mood to your nail length. And 13-in-1 one-stop quick fix pain reliever sold in your local pharmacy. Pills, pills, and more pills. What do they all mean? Pills are tools. And the majority of the population, including people of all ages, is left with question on top of question about medications they come in contact with because they are unfamiliar with each one's power, importance, and entanglement. Questions are likely to rise when someone receives a new prescription, purchase an over-the-counter drug, or a drug distributed without a prescription, otherwise known as an OTC drug, or are put in a strict regimen in the hospital. A lot of people are unfamiliar with what medications they pick up and ingest. Certain combinations and doses can be very dangerous, unbeknownst to the individual. When something dangerous does occur, it is categorized as an adverse drug event or adverse drug reaction. These are known as ADEs and ADRs. Adverse drug events occur when unwanted, opposite, and unexpected events result from the administration of a drug. These events are categorized into two types, Type A and Type B, which will be outlined later in the video. Adverse drug events can occur with various types of drugs. An example of a drug that commonly has adverse effects is a nonsteroidal anti-inflammatory drug, or NSAID. This will be highly discussed in a later portion of the video. With that being said, adverse drug events represent a significant concern across the board in modern healthcare. They contribute to an alarming number of hospitalizations, various extended treatments of patients, which can get really, really expensive, and worst of all, an increasing fatality rate amongst patients. According to the United States Food and Drug Administration, adverse drug events are responsible for an estimated 1.3 million injuries annually, highlighting the vast impact of medication-related harm on patients. As medications become increasingly complex and treatment regimens more diverse, the risk of these events continues to rise. To begin, you already know adverse drug events are classified as either Type A or Type B reactions. Type A ADEs are reactions that occur when the known pharmacological properties of a drug cause the reaction. These types of reactions account for approximately 95% of all ADEs across the board. There are three main subgroups under this type of reaction as follows: overdose, which we've discussed, common side effects, and drug interactions. These occur when a drug is administered in excess to the patient. An appropriate dosage is defined by a patient's weight and age. Overdoses are highly common in cases involving self-administration of a drug and are a leading factor in the worldwide opioid crisis. The most common opioids that are abused and given in higher doses are known as strong opioids across healthcare systems. These are as follows. However, overdoses are also associated with more common over-the-counter OTC drugs. Tylenol, an acetaminophen drug, can cause liver failure if taken in doses higher than the recommended dosage according to the patient's weight and age. Similarly, anticoagulants or blood thinners, such as warfarin, can cause gastrointestinal bleeding or GI bleeding, as well as subcutaneous bleeding if taken in inappropriate doses. The next subgroup, side effects, is more easily defined in simpler terms. These effects are predictable based upon a given dose of a drug. They may be desired, adverse, or inconsequential. Drug interactions, the third subgroup of type A ADEs, are quite a complex issue. Many healthcare providers are not necessarily familiar with drugs that can interact with each other when administered adjacently, which leads to unpredictable effects and extended patient care or even death. Drug interactions can be between a specific drug and other drugs, foods, diseases, beverages, or supplements. Next, type B adverse drug events occur when the pharmacological characteristics of a drug cannot predict the effect on the patient. This type of reaction accounts for only around 5% of all adverse drug reactions. There are also three subgroups included under type B reactions. The first subgroup consists of hypersensitivity reactions. The first type of hypersensitivity reaction is an immunologic effect. This is a reaction that a patient may have in response to the drug because their immune system is weak in opposition to the drug. The second type of hypersensitivity reaction is when inflammatory effects occur. These are more widely known as allergic reactions. Allergic reactions are simply a chain reaction of chemicals in the body intensely reacting to an unfamiliar substance. Symptoms of an allergic reaction often occur in the nose, lungs, throat, sinuses, ears, lining of the stomach, and skin. The most common variety of allergic reactions can occur when a drug causes the expansion of a T cell. T cells are white blood cells in the bloodstream that recognize the drug as foreign and attack it, rather than accepting its assistance in aiding the body. When this happens, anaphylaxis occurs. Anaphylaxis is a type of more immediate drug reaction when an allergy is present in the patient. The next subgroup under type B ADEs is idiosyncratic reactions. Idiosyncratic reactions are characterized by reactions that arise in the patient because of genetic anomalies or exaggerated sensitivity to low doses of a drug. The final subgroup under type B ADEs is pseudoallergic reactions. This type of reaction occurs when inflammatory cells are directly activated by an administered drug. While briefly overviewed but not analyzed in depth thus far, nonsteroidal anti-inflammatory drug overdoses are one of the most dangerous types of adverse drug events. Their danger is greatly underestimated in the healthcare setting because of how common and accessible they are. NSAIDs are used to temporarily inhibit the cyclooxygenase enzymes in the body that are responsible for the creation of chemicals like prostaglandin and thromboxane. In other words, they provide instant pain relief for inflammation at various locations within our bodies. Furthermore, NSAIDs have drug interactions, which are a subgroup of type A ADEs with a great number of substances patients may come in contact with. The drugs NSAIDs should not be taken in addition to are as follows: concomitant medications, other NSAIDs, aspirin, alcohol, antihypertensives, antidepressants, diuretics, and ACE inhibitors, which are medications that are used to treat high blood pressure and heart problems. These are used in the medical setting to treat chronic musculoskeletal pain as well as at home for many people. Instead, adverse drug events are linked to the widest variety of negative physical effects on patients. Some of these include gastrointestinal bleeding, heart attack, death, stroke, kidney failure, high blood pressure, edema, sodium retention, hyperkalemia, cardiovascular harm, and renal effects. The reason these medications are likely to interact with other NSAIDs is because oftentimes people use other medications containing the same ingredients and end up overdosing on the certain drug. If pain continues after taking one medication, they assume it is safe to take another pain medication without checking the label thoroughly. Over-the-counter drugs are a rising problem because of their easy accessibility. This is why nonsteroidal anti-inflammatory drugs, or NSAIDs, were a point of focus in this video. They are some of the most common over-the-counter drugs because they are used for simple chronic pain. Their negative effects, when administered or taken inappropriately, were highlighted for the purpose of spreading awareness to their danger, which is usually unbeknownst to the general population of consumers practically throwing their money at corporations, marketing them as fast, high-dose pain medication with the promise of ease and simplicity. With the growing library of medications and their fatal effects worldwide, the education provided to healthcare providers must also expand in order to provide the patients of tomorrow a higher chance of recovery as well as survival. Thank you.